Welcome to Health Impressions, the show about authority, acquisition, and retention. I'm your co-host, Brian Cush, co-founder of Tidal Health Group, a digital marketing agency specializing in healthcare. I'm accompanied by Jay Parkinson, Chief Medical Officer of Sana, a health plan that delivers high-quality healthcare while keeping costs down. Our show focuses on the cross-sections of marketing, patient experience, and product development. We explore strategies for providing high-quality care, enhancing patient experience, and retention through cutting-edge technologies. We'll be speaking with like-minded industry leaders who will be sharing their learnings and spilling some secrets too. Teri, so great to have you here. Really excited about this conversation. You have some really unique transformational brand strategy backgrounds. Love to just dive right into it. And how do you start to even begin to think about understanding care journeys?
Yeah, thanks. Thanks for having me. So the way I look at care journeys and just any patient journeys, but really any journey, is I really look at what the emotional journey is. So at White Rhino, our background is in neuroscience and psychology and looking at human behavior and how do people make decisions. And a lot of the frameworks that we use are actually based off of health journeys, how patients decide to quit smoking, for example. And what are the emotional and cognitive journeys that they go through? What are their informational needs? But really importantly, what are their emotional needs along the way? And we have some frameworks that we use to look at that. And so I like to really make sure that we're thinking about both sides of that. I think as in the healthcare space, especially from a clinician standpoint, there's this need to get a lot of information, cognitive information in front of a patient, help them make decisions about their health, about their treatment plans. And we can't lose sight of the fact of how emotional that journey is. We work with a lot of brands inside and outside of healthcare, and there's no more emotional journey than a healthcare journey. It's very personal, very emotional. And we have to make sure we're not losing sight of that piece of it.
Is there a rational starting point? I mean, you mentioned this moment of the doctor trying to give so much information. Do you start there and then spiral in many different directions to really understand what's being received, or is there a different entry point?
Yeah, I think interestingly, the journeys they're not linear. We like to think about them in a linear way as marketers because it helps us put a framework together and how we address the different stages of the journey. But patients come in and out of the journey and have different needs in different moments. But I think if we start from that sort of center point of a doctor visit, yes, definitely there's a lot of things that lead up to that moment. There's a lot that goes on in that moment. And I think what's interesting is we spend a lot of time as healthcare marketers thinking about all that before and also the things leading up to. I see less focus often, unfortunately, on what happens after that visit. And think about that visit itself. Often patients are being shared news from their doctor that maybe they know that they're in store for some bad news, or but it's pretty emotional to be in that doctor's visit. And it's really hard if you're in that emotional state to really take in information. So as much as the doctor wants to get out some cognitive information, what are some treatment options that you should consider and helping you understand the risks of maybe a procedure, it's really hard for a patient not just to take that in, but then to even remember that afterwards. So I do like to always kind of ask, how can we reinforce information after the patient visit? How can we support patients both cognitively, but also emotionally throughout the journey, not just leading up to the doctor visit, but afterwards?
Jay, you have a lot of experience in this too, and I think in our kind of pre-interview, you even referenced the percentage of information that often is lost or not translated at that moment of care. Was there a baseline on that?
Yeah, I think that's an interesting question because the research that I've read is that about 85% of things that's said in an oral conversation between doctors and patients in an exam room are forgotten by the patient. So the way I phrase that as a doctor is I'm kind of 15% good at communicating, and it's pretty wild to think about any job, that's 15% good at what they do in terms of like transmitting information is it's pretty sad. So I really get excited about thinking around, how do you really communicate with the patient afterwards? Because it is a very human to human conversation that you're having with the patient at the time. But then you really want to send them almost like a transcript of the conversation and a summary of the conversation that they can understand. And then also allow them to read that and then answer or ask questions after the fact.
Well, I was going to say, Jay, I think you raised a good point about the emotion of the communication itself. And there's so many modes of communication too, right? And the most human in the most relatable conversation is a face-to-face conversation. And again, as a healthcare marketer, you don't have the option to have that human face-to-face conversation. That's happening with the doctor in that moment in the office. But then we're left with email communications and transcripts and taking into account how can those mediums still have that level of connection with patients that sometimes you can only have with that human to human conversation. And so how do we adapt, or what choices do we make in, if only 15% of our message is getting through, let's make sure that medium that we're using is the most effective one possible.
How do you approach the doctor to that equation? I mean, I'm assuming that not everyone's as open-minded as Jay as a provider to go, well, I'm okay knowing that there's a level of inefficiency in my communication. It sounds like there's even a factor or a buy-in that needs to be understood in the provider standpoint of this care journey.
You want to take that one, Jay?
Yeah, I'm going to answer this in a roundabout way. It was funny. 2 months ago, I was at the brewery just right across the lake. And I was in line, ended up talking with the guy, and, he's like, oh, I work for this company. It's a nonprofit that teaches doctors how to talk, empathetically. And I just thought that was like such a cool idea. And, they contract with hospitals, and then doctors take courses around how to communicate hard things. Because, I went through medical school. I never got any of that training. They left it up to my personality to make that exceptional. And some doctors are great at it, and some doctors, as we all know, leave much to be desired. So I think there's a lot of opportunity in, things like this company, and I forgot the name, I'd have to look it up, in helping doctors, learn. Because it's a skill. In anything in life, communicating with your spouse, communicating with your best friend, your colleagues, how do you have hard conversations? It's just really not taught in medical school.
And I think that's an opportunity to help fill in some of those gaps, right? To think about all the touch points that we have with patients. It's the doctor, but it's also the staff that checked in that patient. It's the nurse who showed them to their room. There's all those interactions, and then of course the after visit information, everything leading up to that. And it's really that partnership across those different touch points. And it also depends on the patient preferences, right? Some patients, and depending on the situation they're in, they may want a doctor who's just more straight, here's the facts, here's how it is. They may not need those over-the-top bedside manners for certain things that they're going through. And that may vary based off of the condition the patient has and the decision they have to make, or it may just be based off of their preferences. So there's also a piece, and I'm sure in those trainings that organizations do with doctors, right? They're helping the doctor understand from the patient perspective what the patient needs. And that's going to be different from one patient to the next. Some patients want a lot of involvement in their care and shared decision-making, and they want to know about the journey that they're going to be on. And some patients just want to know what to do, and they're going to have a lot of blind trust in their doctor and what they're being told to do. And so understanding what those patient communication preferences are is important, both for the doctor and then When we think about implementing patient care journeys, both before and after the doctor visit, how, as marketers, are we adjusting our communications to address those different personalities that and preferences that patients have?
How do you begin to tackle then? Do you look at a baseline of the number of kind of patient profiles that you would create? And then is it this ever evolving process to where you want to get to there's a single profile for every patient? Or is there a threshold that you bottom out? Like, how do you think about that?
I like to think about it. There's almost this curve, right? And where if you're not personalized at all, everybody's getting the same message. You're not having a lot of impact. And then on the opposite end, you could be doing a lot of personalization, and you could be having a lot of impact, but the cost is really high. So there's a balance of what's that sweet spot, to your point of how much you tailor your communication to different personas, how far you go in your segmentation and your targeting. So for instance, we work with a children's hospital, and we work on personalization on their website to help support patients in their care journey. And we will profile patients based off of where they might be in their care journey. We'll profile them based off of their location, based off of the specialty they're interested in. But then when we get in maybe a layer deeper than that, and we say, well, should we also personalize maybe based off of not just what, I'll give you maybe an obvious example, not just what region they're in, but if we get down to the city level, we're kind of constantly evaluating, well, what's the value of personalizing content at a more granular level? And as marketers, we do have to balance that, right? Like the return on your investment of that personalization starts to waver a little bit. So it is a balancing act of not over tailoring things, but finding the right balance.
It's funny. I have a dog, right? And so you have to take him to the vet every once in a while. And every time I go, it's, I'm the patient, right? So I was a pediatrician. And so I'm like the equivalent of the mom in the room, right? With a sick kid, And it's so funny because after they explain things to me, I often have to kind of interrupt, unfortunately, and 15 seconds in and be like, I'm a doctor. I understand these principles. So talk to me like I'm almost a colleague. You know what I'm saying? And so some of the things that we're doing and in our practice is, using ChatGPT features to explain things. Like if someone has an issue, and they're not so, medically savvy, you can say, hey, explain this condition to this person like she's in third grade. But if I'm working with somebody like me at a vet, right, explain to this person, what this condition is as if they have a master's in the concept, right? And so it's a really interesting, opportunity to think about using AI to personalize how we communicate. That, of course, depends on the interaction that you have with the patient and the modes of communication, if you can have that sort of email or messaging, mode of communication, not just oral conversations in exam rooms.
Yeah, there's so much opportunity with all the advancements that are coming out with technology, with ChatGPT, the way that websites are structured with more headless and modular approaches to how we serve up content. And there's this concept that really every patient could have a unique experience with your brand at any point in that journey if we use the data and we take those signals, right? And we identify what are the signals that help us understand what their preferences are, what's their level of education, how do they prefer to think about their healthcare, what's their relationship with their doctor. And the more we can take in those signals, we can actually, in a very cool way, use ChatGPT, use other technology to have those tailored experiences where it used to be, right before the emergence of ChatGPT, that you'd have to custom craft all of those different variations. So in a lot of ways, AI is, when we talk about that balancing act between personalization, not personalizing in too much detail because it can be a lot of work and doesn't return a lot of value. AI really opens up the opportunity that we can accomplish a lot more. We can get a lot more personal with a little less effort because we've got the AI helping and supporting us to drive that, which is exciting for me to see how far we can really take it.
Is that now kind of the kind of pot at the end of the rainbow is always the singular personalization, and it sounded like cost was this huge hurdle. Are you seeing that like that hurdle is basically being removed, and you're still now able to race towards this single personalization?
I think yes and no. I think you're right. The challenge has shifted. The challenge used to be cost to do this. I think now, to your point, it's really easy to personalize content, but now the challenge is on a different level in terms of making sure that communication is authentic and true. Right? There's always a risk with using AI and using technology to power those communications, and so the challenges just sort of flip to on a different level, and that introduces a new level of cost and effort to the equation, right? We have to be really conscious about what we're feeding into these AI models, and right, the output is only good as the input, and anybody that's experimented with ChatGPT and just asked it a few questions or played around with it knows that it really is the quality of the input. So, what are we training it to do? What are we guiding it to do? How are we asking it to interact with patients if we're using it to power some of those communications?
If you looked at kind of the full scope of what could be a patient kind of care journey, is there a piece of it that you would focus on first in improving the personalization?
I'm going to think about that and ask Jay if he has a thought on that first.
To me, it kind of goes back to that, I'm 15% good at communicating. If I'm 15% good at communicating, that means the lowest hanging fruit is like the ability for them to 100% understand what I just said and to remember. So I would probably focus on that post-clinical, that post visit communication in a way that, helps them understand, literally everything I just said.
Yeah, I think building on that, if there's a sort of brainstorming here, if there's an opportunity for AI to be there, and there are tools out there, right, with AI in the doctor's office, helping with getting that information into the electronic medical record. But if it can help shepherd that information after, take that information that was delivered in the visit that the patient may not have been in an emotional state to really hear it all, but it was said, and there's information there. The doctor shared information. You could use AI to make sure that information gets repackaged and communicated and emphasized with the patient. There's probably ways you could check their understanding of that information. You can offer easily help them find related information. You could help them know what questions to ask. I think it's really a great use I've seen of ChatGPT is asking out, what are some common questions somebody might ask in this situation. So maybe, and I think that's low risk too, helping a patient know what questions to ask, because you're not giving them answers. And that's the fear, is that in the healthcare space, the AI is going to give the wrong answers, right? There's potentially misinformation that it's been fed, or if it doesn't really fully understand the right context, maybe it's going to give a wrong answer. But if you're asking it to do tasks that are not about giving answers, but are to help people sort of think through and grapple with something, I think that's a safer route sometimes in these early stages of using AI, until we have more confidence in the level of credibility of the information.
Are you almost taking a vote then for the pre-delivery as an area of focus as well? I would think if you want the patient to understand and be primed to ask the right questions to improve the amount Is there then even a pre-care delivery side of educating the patient on how to better communicate with clinicians?
Yeah, well, I mean, I think clinicians would love that too, right? They only have a limited amount of time with the patient. And if they know that patient has come in with either a baseline understanding or they're very clear on the questions they want to ask, it's going to make for a higher quality conversation on both sides. So yes, I think it's a lot, prior to the patient visit. I also wonder, are there opportunities in that patient visit to just help with that mutual communication? It's the same way someone might take a translation app if they're traveling in another country, and in that moment be able to have it give you some information so you can understand what's going on. Are there opportunities that even in the office visit that the patient can, see questions and the doctor can maybe go through those questions with them and say, yeah, here are some common questions. And maybe the doctor knows that those questions have been tailored to this particular patient because we've customized that chatbot in the patient portal to that patient. But then it carries through after the visit, right? It's healthcare is not a singular moment ever. It's ongoing, and it starts from the moment you start to feel symptoms, and then it's ongoing and repeat. And so yeah, how do we foster that throughout?
It's so interesting. You're talking a lot about the visit because that is the thing that is leveraged between doctors and patients. And, what I find really fascinating is all these like new care models that are happening online that don't, mandate that there's a visit where everything has to be gotten, done. Right. And so there's this more sort of ongoing relationship that you have with the patient. And then you call that oral conversation via video or in person to have those, certain elements of the conversation. But I always like to think of health as like stories that happen a story that happens over time, and that's really how a patient experiences their health issue. And it's just that, I've always thought of it as like the tyranny of the visit, because if you don't have to have an oral conversation in an exam room, you can use AI and you can be an amazingly effective communicator. And it's just, we have to be, I think, vocal around, we need more sort of billing codes, for example, for different types of visits, not just real-time oral conversations via video or office.
Yeah, and I think that there lies a challenge and an opportunity in the sense when you talk about the patient, it's a story for the patient, right? It's not a moment in time, but it's a moment that's part of a bigger story. And as we have decreased interactions with those patients, decreased in-person interactions, more virtual or asynchronous, how does that impact the ability for us to make that human connection? And how might, when they do have an interaction with a doctor, how do we make sure the doctor understands that whole story in a quick way, understands the most salient points about that patient's history? I mean, it's been a long-standing challenge, right, in healthcare, is you feel like every year when I visit my primary care, I'm re-giving my medical history, right, my whole history. And if I've just given that information once, and we can use AI to help the doctor know which pieces of that are most relevant to the conversation at hand, or just most important to me, maybe emotionally, right, that can give a lot of context. And I think there's a lot of opportunity in that as well.
When you speak to your healthcare clients, are they leading this conversation? Like AI, like we've been focused on it in here, but it's much more nascent just in probably your experience and this industry's experience. Do you find yourself leading this conversation of deconstructing the care delivery model, or are your clients there as a partner? Are they pushing the conversation? What does that dynamic look like?
I see a lot of curiosity from our clients for sure, uh, and interest in what does this mean. I see more experimentation and active, I guess, proactive looking at this from other industries, not healthcare. I think I see a lot of clients in healthcare sort of a little bit waiting to see how things pan out, and for good reason. Again, it's much more sensitive when we're talking about healthcare data. But I think it's going to be an ongoing, growing conversation. It's going to continue to accelerate. I don't know, Jay, what have you seen in your experience?
I'm always thinking healthcare is like 20 years behind the times, right? Which is like both sad but awesome, because you can basically, you can predict how things are going to pan out. I've always like been inspired by other industries and brought it to healthcare. And I just think it happens eventually in healthcare. It just takes a long time. So, it's interesting to think about like right now, what industry has been impacted the most by AI. And I think it's kind of almost a toy. It's at the toy stage right now, it seems like, and it's just getting started to be like, oh, this is practical and useful. And, the genius of ChatGPT was like, I can show it to my dad and he was like wowed within 30 seconds, and it's like, oh, that's cool. But I think that's almost like where we are right now. And it's hard to say like that an industry has been significantly impacted already. So I'd probably be in that same boat of like, I want to see an industry be kind of almost disrupted and then see, oh, what did it do to that industry and how can we like think about that in healthcare?
It's such a new medium and platform for all of us. I think none of us know exactly what the possibilities are. And what I found is just experimenting with it and starting to see what it can do starts to open up the possibilities. And so one thing that I've seen successful, not as much in healthcare, but I've seen in other industries that is very applicable in healthcare is using ChatGPT for social media writing and saying, for instance, it's National Breast Cancer Awareness Month, and we have maybe a patient who had this condition, and we want to bring attention to this, and you can have a great a colleague that I work with who always says, "Say it ugly," and then as communicators, we help our clients clean it up. Well, that's kind of the method I use with ChatGPT is I just say it ugly. I say, I'm kind of looking for this. What, if you said something like this, and it doesn't give you a perfect response, you still need someone to evaluate that. And if you haven't created a custom model for your brand and your brand tone, then you definitely need to evaluate it. But it can give you some great inspiration, great ideas. It's almost like a research assistant, someone was saying to me. You can ask the same question of Google and ChatGPT, and it can take you probably an hour on Google to get to the same level of answer that you would get to in a few seconds with ChatGPT. So it accelerates our ability to find inspiration. And I think always my advice is to make sure that you really are using that as inspiration and you're still applying originality to that, applying your brand personality, your brand tone, so that it's authentic. Because if there's one industry where we need to make sure these communications remain 100% authentic, it's in healthcare, right? We're never going to have a robotic avatar fake a patient video, right? You're always going to need real, authentic patient videos online. So in healthcare, there's just a level of we have to maintain that authenticity.
Well, I'm always just intrigued by how there's like kind of the real world of healthcare, which is like AI is probably going to be first used in like a cat and mouse game between providers and insurers to like maximize billing and then minimize billing and then sort of, that kind of thing. But then there's other little pockets of healthcare that are doing things primarily online. And like, they're the ones that are kind of going to be leading the charges to show like, how healthcare can be improved and how communication in healthcare can be improved via AI. And that's, always to me, like cutting edge and most interesting. And that stuff's happening now. So, just always got to keep your eye on these little utopias of healthcare, these little pockets of healthcare that kind of operate differently than the status quo.
Going back to your example of, there's these companies that will train doctors on how to communicate with patients. One thought that's crossed my mind is how might we leverage AI as a training tool, and that AI could model what a healthy conversation between a patient and doctor looks and feels like, and doctors could test it out, right? Test out a conversation with ChatGPT and see how the, fictitious patient in that case might react, and get in some skills. And the AI can suggest to the doctor, you might want to reframe how you say that in this way. And what if you said it like that? And I think there's a lot of opportunity for us to learn from the AI because it's modeling what good communication looks like.
Yeah, I think that's always a concern too. You touched on an interesting point that, like, from a social media use, is the value we've always seen, at least in the small nascent testing, is exactly what you mentioned, is inputting kind of like the brand tone, the brand control, like what are these pillars and fundamentals around your position. And the difficulty in healthcare is that it's evolving in that sense as well. Like, one of the things we always talked about early on was when kind of COVID came into our ecosystem, there was this wave of search for information online that was kind of ubiquitous to every category. It was like every medical specialty and COVID. So there's no way to be able to create an AI that can immediately ingest and then pivot that quickly as well. So I'm always of that, like, there's going to be this massive human component around, especially around healthcare. For me, it's always seen as the largest category of search, and some double-digit percentage of search that happened today didn't happen yesterday. So there's always going to have to be like, how do we most efficiently use our time to create kind of a basis of knowledge, but then add your level of expertise or authority on top of that.
Yeah, it goes back to that same challenge of tailoring communications to an audience, right? And how personalized do you get? It's the same thing. If you're just using the generic ChatGPT model to write copy or to help with writing in some fashion, you're going to get pretty generic results. But if you create a local copy, when you get some security and privacy, and now anything that you're feeding to it is private to you, but also you're training it to be more specific. It becomes a more like you would train an employee, right? You've trained it on your process, your brand, your expectations are from a communication standpoint. And I'm sure there'll be a day where we can automate some of that and some of the AI will train itself. But I think we're ways off from, you really need humans, right? You need that human touch, someone thinking through what do we want to train this model on, to produce a better quality communication, and to test that, right? And to test and make sure it's coming out with the output that you want. But there's a real opportunity that you don't have to just use the generic version. I think increasingly we're going to see brands creating their own custom models. We've experimented with some of those. We will drop a message matrix into a custom model of ChatGPT so that it creates more tailored results that aligns with the brand strategy that we've created.
Yeah, I'm curious to circle back around. I think we opened up, might have been the first line you said, was you're really trying to distill the emotional or emotions that you feel a patient's experiencing through their care journey. We then start to walk towards this modeling system. How do we think about either inputting or even extracting emotions from a predictive model?
So I think the first thing to think about is it's actually a very human process. So as humans, the way we make sense of the world and survive is that we classify things that we see, like even the fact that visually, right, this is where some of the neuroscience comes in. Visually, I'm able to see you, see my computer screen, see what's in my office, because my brain is taking all of these inputs and creating a concept out of those. So I know my microphone is my microphone because I've noticed those patterns, but it's not really there in the way that our brains are turning it into a concept. And it's the same with understanding emotion. And that's where the psychology comes into play. Psychology is about sort of deconstructing those signals in creating frameworks and in creating concept models of what does it mean to be happy or what does it mean to be sad, which, by the way, it's very interesting as you look at different cultures around the world. Certain things that we might associate with happiness in the United States. In other regions of the world, certain actions, right, facial expressions may not be associated in the same way. But yeah, essentially, it's about looking at the emotions that someone's having and the words that they're using to describe that emotion. So when we're trying to understand a journey of a particular patient and what's the emotion driving them, we'll talk to them directly, and we ask a lot of questions about what their experience is. And it's the words that they use that are important. And then it's sort of deconstructing those words and tying it back to some of these psychological frameworks so that we know that they're expressing a certain emotion. So for instance, one thing we look a lot at is donors in the healthcare space. And what is it that drives the decision for someone to donate? And one of the prime emotions we found is this concept of hope. And that's a universal emotion in many ways. And people are donating to a hospital to create that hope for others. And there's a real emotional connection there. So there's ways that you can deconstruct it. And so anytime we can break down and create these models, those are things we can teach to an AI model. I think what's interesting, though, is that the AI models, the way especially ChatGPT has been developed, you don't always have to tell it the whole framework. It's actually better to share with it examples of here's what's good, here's what's bad, and it just learns naturally through that experience. But there is sometimes some benefits to say, here's what the emotion of hope means, and here's how we would think about that. Here's some examples of hope. Here's some examples not of hope. And then you go and ask it, okay, now write a social media post that is tailored to somebody to help them, donate to a hospital, and that hope is a key driver for them. It's now going to write a smarter message, or maybe a more emotional message, because we've taken some time to train it on some of those frameworks we've broken down.
That's a really interesting framing. So you feel that it is able to kind of expand the emotional state or value. So there is this kind of litmus to go, we have this body of communications that we sent some letters out and the response rate was better, and it triggered that feeling of hope. So I'm going to feed the model with this. It understands that kind of this passed the test, at least from your analysis. Then just injecting the statement of increase the feeling of hope that this content has. It has the ability to even impress enough that you would recognizably improve it.
Yeah, in my experience, it's pretty well trained. It's just the vast amount of information it's been trained on. I've been impressed with sort of, sometimes it's more well tuned to having a quality conversation than I sometimes have with another human being. I think it's actually pretty smart. But just like if I were to ask you, write me a social media post that gets somebody to, donate because they feel a sense of hope, you'd like, well, tell me more about what you mean by hope, right? And so if we think about it as a colleague, a partner, and we have good inputs and conversations with the AI model to say, here's what we're looking for, here's what we mean by this, because also recognizing that it's been trained on a global data set. So its definition of hope may be different from ours. So making sure that we're communicating and letting it know sort of how we think, and then it can adapt pretty quickly. And I've been impressed with how quickly it adapts. It's mind-blowingly cool, but you have to have that constant feedback loop. You have to also be able to know how to train it when it's off the mark, and know how to give it good feedback to explain why that's off the mark, just the way that you would, teach another human being about what good communication would be. Yeah.
So do you have any predictions for this space, or maybe directions that you're hopeful that this goes into?
Maybe less a prediction. Well, no, this is it's a prediction. I think increasingly authenticity is going to be really important. And so how do we know that there is an authentic human intent behind something that was created by an AI model. How do we know that's producing the authentic connection that we want? I think it's going to be interesting to see how this gets applied in a marketing sense, because I think there's going to be an increased value actually placed on truly original ideas, creative ideas, and information. I also think there's going to be a need to better track copyright, if you will, creative copyright. Because as it sits right now, there's lots of marketers just using the blanket version of ChatGPT, and they're all feeding different brand values into it. People are using tools like Midjourney to create creative, and that's all open for the models to learn and to share those ideas with others. And I think that's a great opportunity, right? The more we can inspire each other, but how do we make sure that artist or that copywriter or that brand gets credit for what it was an original idea that then just got fed into a model and was extrapolated into new things? And I think that'll be an interesting thing to gauge, is how that all gets tracked and traced back, so that those authentic ideas and that authentic creativity is continues to be valued, because that's what's going to keep us growing as a race, to human race, to keep. The more creative we become, the more we're going to flourish. And if creativity isn't valued, then what are we doing, right? And then the AI can just take over the world. So.
Well, this is a perfect story arc. There's a very nice, hopeful cherry right on the top end of this cake. So, no, we really appreciate your time. It's a fun conversation, and I always gets my head spinning and thinking in many different directions.
I'm curious, Jay, what's your biggest hope for AI?
Oh, goodness gracious. That's a good question. I mean, I'm personally a little biased, and I have a little vested interest in helping doctors communicate. So that's kind of like where I get most excited. But in terms of like the rest of the world, I don't know. I'm still on the fence about its true value. I'm really interested in like the creativity side of things, because it's like, I read this book that Lawrence Lessig wrote. I think it's called Code or something like that. It's probably 20 years ago. And it was kind of like an overview of like copyright, the history of copyright in America. And it was really interesting because, the 1980s, early 1990s, like rap songs were all samples. It was all sampling each other, sampling old songs. And like those samples would like go throughout the entire song. And now, because the people that are being sampled were not, credited, and rewarded financially, a lot of lawsuits happen. And now you can't sample more than like 3 seconds or something like that. And it's been really interesting because like the genre of that particular type of music has just basically kind of, it's not as like unique and interesting. So I'm curious, what you were talking about. I thought that was super fascinating around, what is this sort of, is it a societal creativity, and are people going to be upset that like, oh, the work that I'm putting into it is like benefiting society and not me, it's going to be really interesting. I mean, like I said, I think it's in that early, period of time that's like, it's still almost a toy and I still don't know what it's going to do. But at the same time, I also feel like it's equivalent to the iPhone and unlocking a lot of stuff. And I just like, I've always heard that, the second you call yourself a futurist is like the second you admit you're wrong, so like, I always just kind of like, step back and just kind of watch things rather than try to predict. So I don't know, long-winded answer. I don't know, but I'm super curious.
Well, we appreciate the time, Teri. It's such a fantastic kind of thought-provoking conversation that I knew would happen.
It was fun to be here. I could talk all day about this stuff, so anytime.
Thank you for listening to today's episode of Health Impressions, Authority, Acquisition, Retention. We hope you found the conversation insightful and thought-provoking. If you enjoyed the show, be sure to subscribe on your favorite podcast platform so you never miss an episode. And if you have a moment, please leave us a review. Your feedback will only help us improve the show. If you have any thoughts or questions about today's episode, we'd love to hear from you. You can connect with us on social media, or you can send us an email at media@tidalhealthgroup.com. TIDAL healthgroup.com. Until next time, keep exploring, keep learning, and keep pushing the boundaries of your knowledge. Thank you for tuning in, and we'll see you again soon.